like Iran. They want to wait to see whether or not Trump gets beaten in the election, because would they love to negotiate with Biden or somebody else other than me? They would love it. That's their best dream in the world. So many others. So there are some that maybe are, waiting till after November 3rd, the election day. But I think we're doing very well. It would be sad if we blew all of the advantages that we have right now, because we've made unbelievable trade deals, whether it's Mexico, Canada,
You've been watching the White House daily press briefing. President Trump speaking right now. You can stream the rest of it if you like to watch it at ABC7news.com. Meantime, the ABC7 News at 3 o'clock starts right now.
Now, your health, your safety. This is ABC7 News.
We've been covering this all day long, from asking a dating coach your questions during the pandemic to asking a doctor your questions about the pandemic. Plus, Dr. Alok Patel explores the question, why are men dying more than women from the coronavirus? Thank you so much for joining us. I'm Kristen Z. Again, if you want to watch the rest of the White House news briefing, you can do so at ABC7news.com. But right now, we are going to bring you our daily interactive 3 o'clock edition of ABC7 News. So glad you're here. I say interactive because we are streaming right now on Facebook Live. We want to interact with all of you, so definitely feel free to jump in and talk with us on Facebook Live and pose your questions, or even just say hi if you would like. We're also streaming on YouTube, our app, and ABC7news.com. And of course, we're on TV, but the benefit of streaming is you get the added content during the breaks, plus we get to interact. So let's go ahead and start with all the headlines from today. We're going to start worldwide. The Labor Department reports more than 3 million people filed for unemployment insurance in the past week, but the Dow ended up 1,300 points higher, giving it the biggest three-day surge in 90 years. The stimulus package that's expected to pass Congress tomorrow, the Senate already voted yes, so the House is next, is being credited for helping this spike. Locally, there are now 1,331 cases and 30 deaths related to COVID-19. The coronavirus test site in Hayward has set up a helpline, 510-583-4949. Now, our goal of making this 3 p.m. newscast your show, right, is to have you participate in these live interviews. So go to our Facebook page or YouTube page, get on the live stream and ask your questions, and then I'll try to relay them to our guest expert. And today we do have an expert, Dr. Peter Chin Hong, an infectious disease specialist and professor of medicine at UCSF. Thank you so much for joining us.
My pleasure. Thank you.
Well, we got to start with the biggest number that's just come out, and I guess it was only a matter of time. But the U.S. now has 82,000 confirmed cases, pushing us just past China, past Italy, meaning we now have the most number of cases in the world. Does it surprise you that it happened so quickly?
It doesn't surprise me at all. In fact, it was something we were fearing all along. And I would tell the viewers that that probably is an underestimate, because we haven't rolled out enough testing yet in the United States in general. So what you're seeing is really the tip of the iceberg.
All right. So then, based on models that you're seeing and based on what we know about the testing, what do you think the real number might be, at least a range?
I think it's really hard to say. I think what you're seeing are the severe cases going into the hospital, as well as testing in the community. And right now, our testing strategy in the U.S., I would say, in general, has been very disparate, meaning that different states have different capacities, so they're doing different, rolling out testing in different ways. And it's also reactive, not proactive. So when people come into the hospital with certain symptoms, so you call a hotline, we're triaging tests to those who we have a higher pre-test probability of having the real deal. Whereas we know in COVID-19 that many people who have mild symptoms, or sometimes even no symptoms, might actually have COVID-19.
All right. Well, I'm almost a little scared to ask you this question then, but where are we in terms of that wave that we see in all the graphs? How close are we to being at the peak? And I know that depends on a lot of factors, depending on what we each do, might do to social distance and shelter in place. But what does the best modeling say right now about how close we are to the peak?
I think we're at the just beginning. I think different places are at different stages. So I think New York City, maybe hopefully getting to the peak or the plateau Obviously, California, I think, hasn't seen that yet. We're hoping in California and in the Bay Area that we will never hit that peak as high as New York City because, again, we instituted public health measures before New York City did.
That's right. We were about a whole week ahead of them, and the numbers do show it. So I want to ask a couple of our Facebook viewers questions to you now. Nellie says, I live in Livermore, and I just found out that there were 2 deaths in my city. What does this mean for our community? What precautions should our city do for us, or what should we do?
So I think in the absence of widespread testing, I think it's really important for residents in the Bay Area to think about the 4 S's. I think about it as the 4 S's to keep yourself safe. The first S is sanitizing. So of course we focus on hand washing and for 20 seconds and using hand sanitizers. The next S is going to be about surfaces. So you want to clean all surfaces as much as possible. The third S is probably one of the most important things that we in the Bay Area have done, which is social distancing. Of course, you want to stay 3 to 6 feet away from someone because, again, because of lack of testing, we don't really know if that person in Safeway has COVID-19 or not because
Sure.
they may have very mild symptoms.
Sure.
So that's the third S. And the fourth S, of course, which is really important for all of us to do, is to stay home if we're feeling sick.
All right, we're going to ask a question now that was posted on Twitter from a fan or a viewer, I should say. What is the difference between the last pandemic 10 years ago and this? I assume they mean the swine flu.
Or they might have meant the SARS epidemic that was the original SARS in Asia.
Okay.
I'll speak to both of them. So the original, probably the most interesting comparison, I think, as a clinician is how is this SARS-CoV-2 that causes COVID-19 different from the first SARS? There's actually a very big difference in one way that I think is important for public health and for people to know. In the first SARS, people didn't really start transmitting virus to each other until they started to feel sick. So it was easy for someone when they know they're sick, you kind of don't want to give it to somebody else, so you kind of stay away from them. And this SARS-CoV-2 that causes COVID-19, we know from early virologic studies that the peak of viral transmission is just when people are not as yet quite sick. So that's why there's been, we think, more infection and more transmission in the community. But again, there's something that each of us can do, and those are the 4 S's that I talked about.
Okay. Rich Honda asks, are the people with mild symptoms recovering without the symptoms progressing?
So the people who are recovering, I feel that they probably, as a clinician, I don't think they're going to be progressing anymore. I feel that they're kind of on the home stretch. I think the interesting question is really, are they still transmissible to other people? And I think that's something we're grappling with from the medicine side. And I think there's one test that I think people are working on very feverishly, and that's going to probably revolutionize, when people can be safe and when they can go back to work. And that's actually the serology test. So we're developing a test that checks people's antibody responses. So you can imagine that because I told you that many people don't even know they might have it, if you can demonstrate that somebody is antibody positives or they had antibodies to the virus, they'll have almost like a magic force field around them, and they can probably just interact with others. But again, that's a little bit early, but I think very, very tantalizing, and one of the things that I'm most excited about.
Yeah, and this is kind of a related question, and this is if people were to recover from it, does that mean they have immunity now? And if they do, for how long? Do we know?
Exactly. I can answer the first part of the question. I'm getting a good sense of it based on my knowledge of other infections. So the common cold, everybody knows about that. Well, about 200 different viruses can cause the common cold. So of course you can get it again because the chances of somebody in kindergarten with that runny nose having the same one that you have is going to be very unlikely, given that there are chances of 200 things causing it. With SARS-CoV-2 that causes COVID-19, it's kind of just one thing. So we think that if you got it, you're probably not going to get it again. In fact, there's been some interesting monkey studies where they gave the monkeys COVID-19 and they tried to infect them again. And this was recently published within the last few days. The monkeys didn't get it again. We think that in humans, once you get it, you're not going to get it again, but we don't know how long that immunity would last. That's why people are working on a vaccine.
All right. Well, those monkeys' response, that gives us some hope. Here we have another question from someone asking, I read that this could be transmitted by air. Is that true?
That's not, well, I mean, it's true in a very sort of technical sense, but not true. It's not like TB or measles. We've spent a lot of time thinking about that. In measles, to give you a contrast, a person with measles sits in a room, they leave the room, and then you come in that room without the person there, you can get measles. Mm-hmm. That's true airborne transmission. TB is similar, not as transmissible as measles. Mm-hmm. Take respiratory viruses now. They are a virus that travels on a drop. The drop is very heavy compared to TB and measles. The drop falls within 3 feet. That's why when you stand 3 to 6 feet away from somebody, even if they have it, you're not going to get it. That's why the social distance of 6 feet is so valuable.
Absolutely.
So to answer the question in general, it's not really in the air like TB or measles. And that's why staying 6 feet away from somebody should generally protect you.
All right, Dr. Chin Hong, all great answers. Thank you so much. We're going to take a quick break on air, but if you're streaming, then the show never stops on Facebook or YouTube. We're going to keep those questions going for Dr. Chin Hong, so please join the conversation online. Also coming up, ideas for home cooking with kids and a dating coach for this day and age.
We are in commercial break.
All right, Facebook friends, thank you for hanging out with us today. We continue to ask some great questions of UCSF Dr. Peter Chin Hong. I want to ask you this one because I'm very interested in the idea of whether you posted somewhere, I read that the virus likes people more than weather. What do you mean by that?
So I think that, of course, so let me just start with the first principles. The virus kind of likes cold stuff. So like a doorknob is kind of like a perfect home for the virus, although it's really looking for a human. Mm-hmm. The doorknob is not the exact ideal bed for the virus. So it's really like a human to human best way of transmission. So again, going from your mouth or sneezing or coughing to somebody else's mouth or nose. Of course, the doorknob is important because if you touch the doorknob and then touch your mouth or nose, you could potentially transmit it or get infected. So coming back to the warm versus cold thing, again, it doesn't like warm as much. Yep. That's why washing clothes, I think, is probably helpful in terms of cleaning those surfaces in warm water. But, we've seen lots of warm places like Singapore and Hong Kong and parts of Australia where there is COVID-19. Mm-hmm. I think it's secondary. So if there are enough people around it, it's going to just jump from one person to the other and it doesn't really care about the weather.
Okay, we literally have 20 seconds, but is it safe to take Advil? Trudy Barnes wants to know.
Yeah, that Advil, 100% safe right now as we know it. It was a very conflicting recommendation from the WHO last week that was based on hearsay and anecdotes.
Sorry, we're out of time. That's 5 seconds left, but thank you so much. We'll have this.
Thank you.
All right, we are back. Going to shift gears here a little with kids at home right now. One thing you can do is to get them more involved in cooking. Not only does it give them something to do, it also promotes family bonding and teaches useful life skills. In this segment of Home Cookin', author of Half the Sugar, All the Love, Jennifer Tyler Lee, has 3 easy recipes to get your kids engaged. Now, if you're watching on Facebook Live or YouTube Live, leave a comment and tell me what you've enjoyed making at home.
I love getting kids involved in the kitchen because it teaches them a lifetime of healthy habits. So I've got 3 easy ways that you can engage your kids in the kitchen.
Yeah.
Double chocolate brownies, awesome animal toasts, and tasty toaster pastries.
All easy to make?
Yes, and all half the sugar.
Perfect.
Let's make double chocolate brownies.
Okay.
I'm gonna show you how. All of this, what I love about it is it's in the food processor. And there's a secret ingredient.
What is it?
Sweet potato. Ooh. Yes. Okay, so this adds natural sweetness, and it comes packed with fiber.
There you go.
Sweet potato goes in. All right, we've got a little bit of melted butter, an egg and an egg yolk. So the extra egg yolk, when you take the sugar out, the extra egg yolk helps bind it. Almond butter.
Okay.
The other nice thing about this recipe, it's gluten-free.
Is
because
it?
it's made with sweet potato.
I love it.
Okay, a little bit of maple syrup. How about some vanilla? Put that in. All right, all of this just going straight in. This
chocolate?
is unsweetened cocoa powder. And then pulse. Let's
do it.
Pulse it a couple times. There you go. Go. There you go. Okay, now you can let it run.
Okay.
Like this. Once it's all blended, you're gonna stir in your chocolate chips. Okay, this is 1 cup of semi-sweet chocolate chips.
All right, chocolate chips,
Yes,
there we
give
go.
it a little stir.
All right,
go.
that's just about it.
And then you're just popping this into the oven, 27 minutes, 350, done,
Ooh.
right? Give it a taste.
All right, can't wait.
Super fudgy.
Oh my God.
Yeah,
I love it because it's super chocolatey without feeling too sweet.
so fudgy. Delicious. Okay, so number 2, we're gonna make some adorable animal toast. This little owl I do with strawberry jam. You could use whatever kind of jam you like. A few little strawberries on the side. Those are slivered almonds, banana.
For the feathers?
Yes.
Oh my gosh,
Just
they're
super
almonds.
fun and easy, and you know your kids can get creative. All right, so I've got almond butter in there for you. Just spread that on. Now you're gonna use sliced bananas for the nose and the ears. Great. Now the blueberries, just pop 1 additional blueberry on the nose to make a snout,
Okay.
and then 2 for the eyes.
Wow.
And easy.
Yep.
So you can do
It's
this
like
with
art class and cooking class wrapped up in one.
That's right. I love it. So, and it keeps them occupied, and then they're having a really healthy snack afterwards, right? So
This is a very good idea.
And
Okay,
number
now.
3, we're gonna make tasty toaster pastries. So I've rolled out the dough for you already. So cut it into 6 long strips.
Okay.
Okay, so use your pastry cutter, just give it a cut there. This is a strawberry jam that I made to put inside. You're gonna take the bottom half, put a little section right there, and then we're gonna spread it out. All right, so we're just gonna fold it over onto itself. Okay, you do this one.
Okay, I'm ready.
There you go.
Ready, coach.
There you go. And it's so easy. Okay, and isn't that satisfying?
Yeah.
Okay, so you fold it over like that, and you're just gonna press together the sides like this with your fork.
Oh, okay.
Okay, and the kids can work on their design. You're just basically sealing up the side
I
of the
see, I
pastry.
see, I
There you
see,
go.
okay.
Okay, so then you're gonna poke the holes. All right, you're baking it 12 minutes, 12, 13 minutes until it's nice and golden on top, and then here you go.
Voila.
Okay, give it a taste. And these are also great. You can freeze them.
I just tasted the pureness of the strawberry.
It's really jammy.
Not too sweet. This is a winner.
Good.
Okay, it was just an excuse for me to eat. No, actually, those are all great ideas to try with your kids now that they have a lot of time at home. Karen, I wanted to mention on Facebook, Karen Elbrick mentioned that you made pesto with the kids. Yum. That sounds great. Post a picture for us. And if you happen to make any of those, the monkey toast, for example, share that with us, hashtag us, and we'll try to put it on air. All right, we have covered important questions about the coronavirus, cooking at home, and now dating. A dating coach will be joining us to talk about how to do it effectively in this new stay-at-home world. So that's coming up. But during the break, I get to interact with all of you on our live streams.
We're in commercial break.
All right, folks. What do you think of the show so far? I hope you've enjoyed it. We like bringing you a combination of the latest information that you need to know with regard to the coronavirus and where we're at in the Bay Area. But just as importantly, we also want to bring you things that you can try at home, things that you can do with your kids, and also we'd like to see your ideas posted. So definitely share them with us. Tom Tauramina, I hope I'm saying that right. You posted, "Thanks ABC News, you're my go-to news station." Well, thank you. I can't tell you how much all of us here appreciates hearing that. I know my colleagues have been working around the clock, some from 3 a.m. to 11 p.m. So thank you, thank you. Oh, Jennifer Tyler Lee, the modern mom whom we just saw in the piece, is telling Karen Albrecht, love it. Definitely share a picture of what you made, the pesto. We all need a little inspiration and fun right now, indeed. Let's see. Who else commented? Sergio Gomez, I see you posting a lot, so I know you're a big fan of ours and loyal viewer. Very informative, Kristen. Thank you. You're most welcome. That's what we aim to do, share information, but also try to lighten things up a little bit and try to share ideas with each other so we can get through this and try to make, you know, lemonade out of lemons. So keep those comments coming. Let's see. Yeah. Oh, producer talking to me. Hold on.
30 seconds.
Okay. Folks, my producer just talked in my ear. See, we wear these IFBs so that we can hear the control room in the booth. And so this pertains to our next segment, the dating coach, and that's coming up. So
10 seconds.
here we go. Okay, one major hurdle that those of us who are single have to deal with in isolation is how do you find love? That's not me, but we brought in an expert to help out. And if you have questions, post them right now on Facebook Live or YouTube Live. Erica Etten is a dating coach. You see her right there. She's also the founder of the dating coach website, alittle-nudge.com. Hey, how's it going? Thanks for sharing your ideas with us, Erica.
Sure, thank you for having me.
Yeah, so I'm hearing, look, from some friends, my dating life has come to a full stop, right? I can't go out with people. So, talking to people is just not the same, either via text or on the phone. So what is your big advice to folks right now?
Well, they're right. It's not the same. There's no substitute for meeting somebody in person and seeing if you have chemistry. Obviously, that is not possible right now. So there are still ways. I mean, statistics show that when people are stuck at home, whether it's snowing or you're in quarantine, the usage of the dating apps goes way up. Because when you're home, what else are you going to do? So I would just recommend, rather than, if you're going to do the dating apps, rather than endlessly text someone for the rest of eternity, have an end goal in mind. Since that end goal can't be an actual face-to-face date, maybe that end goal is a phone call this time around, or maybe it's a video chat like this. Maybe it's a Zoom call. But remember, when you are doing that phone call or that Zoom call, you're still making a first impression. It is still a first date, even if you have pajama pants on the bottom. So just make sure you're, I'm not kidding. I mean, so just make sure you're still putting yourself together. You're, wearing an outfit you would feel proud in, that you want someone to see you for a first impression. And you don't even have to worry about who pays. So.
That is very true. I have to say, Erica, I'm a fan of the show on Netflix, Love is Blind.
Oh,
and
me too.
I almost think it's better if you just talk on the phone and don't actually even look at them, the other person, and kind of judge whether you like their personality. Yeah.
Yeah, it's just different. I mean, in normal circumstances, I actually don't give the advice to talk on the phone before meeting, because it's really easy to judge someone based on one thing, their phone voice or their, some little tick or something like that. Yeah. But in this case, it is a way to meet to get to know someone in the absence of being able to meet people. Just remember that you can't get the whole of someone's, I guess, aura or whatever you want to call it if you're on the phone. But again, if you are on the phone, or especially if you're on Zoom, I mean, I looked at the background here a million times to make sure I didn't have like a loose sock or something. People are looking at your background. They're seeing your dead plant. They're seeing your toilet seat up. So just take extra precautions and make sure you're cleaning up.
That's right. Watch that Zoom background there. Okay. Hey, Erica, Tom Barton has a question for us on Facebook.
Sure.
He asks, how about sending someone some flowers as a surprise to show how much you care?
I would not do that if you haven't met someone before, because that would come off as you're coming on too strong. Okay. But if you are dating someone, you've met them several times and you're just not able to see them right now, flowers are amazing. I mean, while deliveries are still going on, you should absolutely do things to make sure somebody knows you're thinking about them. But no, it would be coming on too strong if you send somebody you don't know flowers.
Okay. Erica, I was talking to one of the 20-somethings in the newsroom, and he mentioned, people are talking about, what if we decide to go out on an actual date, but let's say it's a hiking day and we maintain 6 to 8 feet apart. Yeah, is that okay? Do you recommend
That's a matter of personal preference. Some of my clients have been meeting people for walks standing 6 feet apart. Some haven't. I wouldn't feel comfortable telling someone whether to do that or not, because I would say that's really a matter of personal preference. I've found that most people I'm working with anyway have not been comfortable with that, but I work with people generally in big cities where it has been hit harder, so I have a skewed, audience. But do whatever is comfortable there. I can't answer that one. Just make sure you're keeping your distance. You're not jumping into bed with someone you haven't met before. And I say that sort of facetiously, but not. Now is not the time to be making out with a stranger.
Yeah. All right, Erica, thank you so much. Great advice. Your website is alittle-nudge.com, and you can find more dating tips and their services there online. We'll be right back on air with more of our live streams right now. All right, Erica. So we got maybe one more question that we can try to get in from our Facebook friends. You know, I don't know if you know the answer to this, but somebody asked, I thought Tinder was going to be free. Do you know what happened to that? Is that your area? Yeah.
Yes, actually. So Tinder is always free, but what they're doing now is Tinder has an upgrade called Passport, where you can search in any city, any town, anywhere in the whole world. Usually that costs, well, interestingly enough, this is TMI. Usually they age discriminate. If you're under 30, you pay less. If you're over 30, you pay more. $2.99 versus $19.99, which is very interesting. But they're going to be giving everyone Passport for free while most people are self-isolating, so you can talk to people anywhere in the world.
Okay. Sorry, our producer was just saying something to me, and I'm not sure I understand what that. We have video dating tips.
Oh, I do have some of those too.
Oh, yeah. Can you offer us those video dating tips?
Sure. Right now?
Yeah.
Yeah, absolutely. So, like I was saying before, you want to make sure you're dressing for a first date. It's pretty uncomfortable if one person shows up in a ripped t-shirt and the other has actually tried and put on some makeup. Again, clean your house. Make sure you're well lit. So I could be better lit right now. It's getting a little dark here. I'm on the East Coast, but lighting should be coming generally from in front of you, so that way you're not washed out by the sun coming in from the background.
I'll have to leave it at that because we're going back on air. But Erica, that was great. I hope folks visit your website for more, and hopefully we'll chat again soon.
Thank you for having me.
Thank you. All right, 15 seconds more before we go back on air on ABC7. Boy, this caused... We are now able to bring you even more content now that we have this new platform at 3 o'clock every day, and that means we get more from our special correspondent, Dr. Alok Patel. He is part of our coronavirus team of experts. Every day, he's going to talk directly to you in a segment we're calling Doctor's Note.
I'm Dr. Alok Patel, and on today's COVID-19 Doctor's Note, let's talk about why in several countries, men seem to be dying at a higher rate than women from COVID-19. In China, the death rate was 2.8% for men, 1.7% for women. In Italy, more than 70% of those who died were men. The death rate for men was also higher in France, Iran, Germany, and South Korea. So what's going on? The answer is probably a combination of biological and lifestyle variables. Scientists do believe women have a stronger, more robust immune system than men do. Women do have a higher risk of having autoimmune disease, but men worldwide are more likely to have hypertension, cardiovascular disease, chronic lung disease, or a history of strokes. Guys are also more likely to smoke cigarettes and drink booze. And all this put together is probably what's causing this difference in death rates. But it's still early. These numbers could change as we get more tests and more data. So in the meantime, stay safe and stay tuned for more COVID-19 updates.
All right, some good advice, as usual, from Dr. Alok Patel. We're going to give you a quick recap of what we covered today and the latest coronavirus developments in the U.S. The Labor Department reports more than 3 million people filed for unemployment insurance in the last week, but the Dow ended up 1,300 points, giving it the biggest three-day surge in 90 years. But keep in mind, that's after many, many down days. The stimulus package that's expected to pass the House tomorrow, it already passed the Senate today, and then after that, it'll go to the president for his signature. That is being credited for helping to spike some enthusiasm from investors there. Now, locally, there are now 1,331 cases and 30 deaths related to COVID-19. The coronavirus test site in Hayward has set up a helpline for you. That's at 510-583-4949. But remember, we reported today that they've tightened up restrictions on who can get the testing. They have to cut back a little bit because the demand was so high, and they always also want to reset so that they can provide some mobile testing services to the first responders. I just want to give you the global figures as well. That is the latest. Right now, we have 526,000, so about 500,000, a little bit more than that, cases confirmed in the world. The U.S. just this afternoon took over the top spot, not a spot we want, but in terms of number of cases, we have 82,000 now. China has 81,000 something, Italy at 80,000 something, followed by Spain at 56,000. So that number is still growing for us, folks. So the best we can do is to slow it by social distancing and sheltering in place. Thank you so much for joining us today on this new experimental interactive show. We'll see you again tomorrow here at 3 o'clock on air and on Facebook Live.